Good morning, everyone, and welcome to this morning's webinar on mental health during COVID-19. My name is Maxwell Okello. I'm the Chief Executive of the American Chamber. And I want to just begin by a few quick housekeeping rules as we progress. Please note that as usual, the session will be an hour long. We'll try and keep it within an hour. Your audio and video will be muted or turned off during this entire session. We do have with us today 3 speakers whom I'll be introducing shortly. The speakers will go through their presentations sequentially, after which we'll have a Q&A session. Please, as we move along, do type in your questions in the Q&A tab at the bottom of your Zoom screen or your Zoom window. I want to just emphasize that again. Do type in your questions in the Q&A tab, not the chat tab, the Q&A tab at the bottom of your Zoom window. That makes it easier for us to track your questions and creates a much more and a better experience for you. So I want us to begin. People around the world are facing increasingly mental health issues during this COVID pandemic. Keeping your team members protected from chronic stress and poor mental health during this extraordinary global challenge is crucial to maintaining well-being and hence capacity to fulfill their roles. I would imagine in turn, the company's overall productivity. This crisis brings potentially lethal physical health consequences to our workforces. However, it's the mental health implications, the stress, the fear, the uncertainty that can be truly devastating. The mental stress of isolation, the threat of losing one's livelihood, and the physical challenges of our new work spaces. For us, it's some of us, it's a bedroom. For some of us, it's probably your kitchen table. For others, it could be, some little space somewhere in a corner in your living room. And these spaces are not necessarily fit for purpose. And so we are finding that, it's not business as usual when it comes to how we work. We find ourselves juggling between business and work commitments with increased childcare and homeschooling responsibilities. And of course, worries about our older family members and so on. And this is something that I believe a lot of us are going through. I myself, have a 5-year-old who for her, daddy's home and it's playtime all the time. So you find that a lot of the times you're busy just, managing her as opposed to getting your work done. So that has a dip in productivity as well. And at the end of the day, you really feel stressed out because you feel like, you've not been that productive. Yet, you also have the obligation as a father, as a mother, to your child. And so that risk the risk of physical and emotional abuse has also shot up. We've seen rising incidences of abuse within homes. And I must say that our children are also at risk in this situation. So all indications point to the current situation being part of our long-term future. And we have to learn to live with COVID-19, or so we are told. But how exactly do we do that? How do we work? How do we manage to live with COVID at home? So to help us explore how we can maintain our own mental well-being and that of our teams now and in the long run, we are pleased to have with us today an excellent panel of speakers from CIGNA. And for those of you who may not know CIGNA, they'll be introducing themselves shortly. But CIGNA is actually a leading global health service company that is dedicated to helping people improve their health, their well-being, and their peace of mind. And so with us today, we have Leah Cotterill, who's the Chief Distribution Officer, CIGNA Middle East and Africa. And Leah, I hope I pronounced your name properly. We also have with us Gil Nisans, again, forgive my pronunciation, who's the Business Development Director for Africa at CIGNA Global Health Benefits. And our main speaker for today a well-being consultant, Dr. Yolande Coombes. And Dr. Coombes, just a few words about Dr. Coombes. Dr. Coombes is a seasoned trainer and educator, a coach and a therapist. She specializes on issues that inhibit performance in the workplace, including individual mental health issues, stress and anxiety, as well as team dynamics. Dr. Coombes is the only qualified rapid transformational therapist in Kenya. So with that being said, I want to quickly hand over to Leah, who will give us an introduction, CIGNA, and kick us off. Over to you, Leah. Thank you.
Thank you so much, Maxwell, much appreciated, and good morning, and thank you so much for attending this, this session. I'm really pleased to be with you. By means of introduction, my name is Leah Cottrell. I'm the Chief Distribution Officer for CIGNA in the Middle East and Africa. As Maxwell's referred to, we're going through unprecedented times, and COVID-19 has affected our communities in lots of different ways, and I completely understand how stressful the unpredictability of this current situation can be, both as a leader, a spouse, and as a parent. The pandemic is changing the way we work and the health systems in countries across the whole world. While remote working has been discussed at length and been explored in terms of the future work scenario, its abrupt arrival has led to many unique challenges, and I think Maxwell's referenced some of them. Lack of space, lack of infrastructure, and distractions. However they may come to us. Understandably, the situation has brought on unparalleled levels of stress and anxiety, and now's the opportunity for employers to play a greater role than ever in their employees' health. And post-COVID, every organization is going to have to invest in health resources to make employees feel safe. At CIGNA, we're dedicated to improving the health, well-being, and peace of mind of those that we serve. And now more than ever, we want to deliver on this commitment to our communities and to our business partners, our clients, and our members. And that's really why we wanted to partner with Amcham in Kenya to deliver this webinar to help you and your teams through these times. Before we delve into the topic, I'd like to spend a minute or two just sharing a quick overview of CIGNA for those of you who may not be familiar with us. So for more than 200 years, CIGNA, who's headquartered in Hartford, Connecticut in the US, has led its mission to help people live healthier, more secure lives, and is recognized as one of the leading providers of health service solutions, both to individuals, employers, and governments. In fact, CIGNA is the employer, it's also the employer of choice, but it's also the insurer of choice for many international companies and international organizations as they expand their operations across the African continent. We're also delighted to share that just a couple of weeks ago, CIGNA moved up 52 spots on the Fortune 500 list to become number 13, and that was following the acquisition of Express Scripts about 18 months ago now. Across Africa, we partner with Hollard, and Hollard are the leading Pan-Africa insurance group. The Hollard-CIGNA partnership allows us to achieve the best of both the Hollard and the CIGNA worlds, both with the local knowledge and licenses of the leading South African insurance company, combined with the international service standards and risk management model of one of the largest health insurers in the world. CIGNA has the honor of serving over 250,000 members, both locals and expats, across Africa. And that makes us the international provider with the largest footprint across the continent by far. Importantly, we continue to build our local presence in Africa, and we believe really strongly in that. In September of last year, we launched our business operations in Kenya. We now have a team of over 120 based in Nairobi. And for some time, we've supported members with localized clinical case managers in DRC, South Africa, and Kenya. And finally, and last but not least, and Gilles is one of the team there, we have a sales and administrative office in South Africa. So getting back to the topic, our focus for today is mental health well-being. And stress has already been the bane of modern working society. Indeed, a 2019 CIGNA global study revealed that 84% of those surveyed reported to be stressed, with 13% facing unmanageable levels of stress. The same study also showed that the level of employer support in stress management is low, with only about 28% of employees stating that they get adequate support from their employers. So this clearly creates an opportunity and really, a driver behind this particular session. We recently also launched a CIGNA COVID-19 global impact study. This research is the first in a new series of studies from CIGNA to better understand the global impact of COVID-19 on people's well-being. In the first phase, it showed that 79% of people reported that they were experiencing this always on working environment, and that this is only increased and exacerbated during the COVID pandemic, where your laptop always seems to be there. Coupled with that, an underlying fear of becoming redundant may have also led to increased pressure on employees to always be accessible and switched on. And that further blurs those boundaries and those really important boundaries between personal and work time. And add to that, obviously, the widespread fear of contracting the virus and the uncertainty of how long the situation will last. That's bound to lead to further emotional stress, fear, and anxiety. And that being said, we're committed, CIGNA's committed to support our partners and our clients with not only their physical health and well-being, but also their mental health and well-being. And a little later, after our keynote speaker, my colleague Gilles Nissen will share some of the tools that CIGNA offer to support employers and employees. So, without further ado, I'm absolutely delighted to invite Dr. Yolande Coombes to take forward her keynote address. Dr. Yolande's career started as a lecturer in public health at the London School of Hygiene and Tropical Medicine, followed by the College of Medicine in Malawi. From there, she went on to put theory into practice, working on health promotion and behavioral change interventions for several international organizations, culminating with almost a decade with the World Bank. She's worked in more than a dozen countries in Africa and has spent 15 years living in Kenya and 6 in Malawi. Throughout her career, her focus has been on using evidence to change people's behaviors individually and collectively, building on her experience as a seasoned trainer and educator. Yolande retrained as a coach and therapist. She specializes on issues that inhibit performance in the workplace, and this includes individual issues such as depression, stress, and anxiety, as well as working with poorly functioning teams. She's also the author of several books and peer-reviewed publications. So we're in great company. So without any further delay, thank you so much for joining us, and over to you.
Thank you so much, Leah, for that introduction. Good morning, everybody. So I'm normally based in Kenya, but I'm currently not able to get home because I happen to be out of the country when the airport got shut down. So I'm really looking forward and hoping to getting home. Luckily, I am with my family, but missing home and missing my dogs. And that's one of the impacts of this lockdown for me, because I'm not in my normal office and where I would be working. So I'm very delighted to talk to you this morning and to share some of the insights that I have about this virus and what's going on. So let me just dive straight in. Sorry. Okay, so what are going to be some of the impacts for mental health? As you know, as you keep hearing on the news, this is a new situation, a novel virus. We don't know much. And with this, we don't know as much as we would like to about the impact on mental health, but we're getting some information. So there was a survey that took place in April that was just done by somebody as part of a master's university thesis, but it was comparing to 2018 data, and it had a reasonable sample size. And what that survey found is that people are 8 times more likely to screen for positive, serious mental illness now during the current crisis than they were 2 years previously. And 70% of people met the criteria for moderate to serious illness, compared to 22% of those who screened for illness. So this tells us that this virus has had a huge impact on mental health. And we do know that people who actually have the virus, there is some information that suggests that people who actually have the virus, that it's led to some mental health issues such as psychosis. But the bigger impact is on the rest of us. Those of us who are having to be in lockdown, are having to work in different situations, be in different situations, that's having a huge impact on our mental health. So why this big increase in mental health? Well, as you know, and as was already said by Maxwell and Leah, the fact that we're having to work at home is causing huge problems for many people. But it's also the whole aspect of social distancing and isolation. For people who are living alone, many of them are not having proper interaction with other people. The interaction they're having is the type of interaction we're having now, which is all done on a video screen. But they're not being touched, they're not being hugged. These are important things for our well-being: touch, being with people, being able to have time off and time away from work. Homes now are the office, they're the gym, they're the playground, they're the school. We're doing everything in our home. We're also having to deal with the financial worries. We don't know what the financial impact is going to be for us personally or for our country. But what we do know is that there is going to be one. We can all see it. It started. Unemployment, difficulties for particularly in Kenya, in the Juakali sector, where so many people have lost their jobs, but it's increasing amongst other companies. We also have to, as Leah said, we've suddenly been thrown into this new video conferencing way of working. Remote working has led to longer hours, blurring the boundaries between people's professional and personal lives. And as you see in the photo on this slide, particularly for women who may be dealing with childcare at the same time as having to be professional. And, you know, we mustn't forget, for example, our junior employees who have really benefit from face-to-face contact. Most junior employees learn by modeling. They learn by looking at their managers and the people around them, and they model those behaviors and they learn what to do. So much of what we are able to do is learned by looking around us. When we're in isolation, it's very difficult. How many of you, for example, there's a person that you go to when the photocopier is not working, or when you don't know how to do something, or you're not sure how to fill out your travel claim form? All of those small little interactions are what make work function better. And it's very difficult to do them when it actually involves a phone call as opposed to a 10-second walk across the office to chat to somebody. We've also got things like the noise of working from home, the stress of living on top of one another, and as was mentioned, the issues around domestic violence, which we've seen a huge increase worldwide, and child abuse. These are issues that were previously hidden, which perhaps this whole COVID-19 is going to throw a spotlight onto. The fact that we have these hidden issues within these groups. The other thing that this whole coronavirus has done is it has exacerbated pre-existing mental health conditions. Now, interestingly, we are seeing an increase in mental health issues globally. And for example, particularly amongst young people, and we are seeing that anxiety and depression are particularly on the rise. Anxiety and depression are often thought of as two sides of the same coin. And we see that anxiety is particularly increased amongst young people, the sort of 18 to 30-year-olds. We're seeing a rise in increase in suicide, particularly amongst men, and that is true in Kenya. We're seeing an increase in suicides amongst young men. And one of the theories put forward about this is that men find it harder to talk to people and are more likely to try and cover their behaviors. So people don't know that they're struggling. And that's particularly to do, if we think about our culture in Kenya, it's the same in many countries, but mental health is seen as a weakness. If somebody is off work because they've broken their leg, it's not an issue. But if somebody is off work because they're feeling stressed or they're feeling anxious, it's seen as a weakness. And we have to change that. We have to change the way that we talk about mental illness, about mental health problems, and we have to make it more acceptable for people to say, you know what, I'm struggling a bit at the moment. I want to talk to you about two theories in psychology which I think may help you to understand some of what's going on. And the first is a theory called locus of control. Locus of control is about whether or not you think you are in control of your health, or you are in control of your life, or whether you think it's more to do with luck, fate, chance, God, other people. What we do know is those people who have an internal locus of control, who believe, you know what, it's up to me, I make a difference. If I take charge of my life, I can affect my health, I can change, I can take control over what I earn, where I live. Those people tend to be healthier and tend to be more successful. People with an external locus of control who believe in fate, luck, or chance, they are often don't have as good health outcomes. So, for example, one of the first bits of research I ever did 30 years ago now was looking at stage of diagnosis for breast cancer and people's survival rates. And one of the interesting things is that it wasn't just the stage of breast cancer that determined whether people survive for 5 years. It was also their attitude, whether they thought they could get over it. So if you are a stage 1, i.e. an early stage, and you should therefore survive more, your survival rate should be higher. But if your attitude was, well, this is it, I'm going to die, well, then you tend to die earlier. So somebody with a stage 4 breast cancer diagnosis, which is very serious, but who took the attitude of, you know what, I'm going to fight this. There are things I can do. I can change my diet. I can start exercising. I can reduce my stress. Their survival rates are better. So locus of control is really important. And I'll come back to this in terms of how you're dealing with your staff. The other theory is around learned helplessness. Learned helplessness is where if we feel that doesn't matter what we do, the same outcome is going to happen, then we start to feel helpless. And we know in experiments that have been done, the more that you feel helpless, then the more that you give up across all areas. Doesn't matter what I do, nothing's going to change. Now, learned helplessness, interestingly, is one of the main reasons that people change jobs and leave. And it's normally to do with having a boss who is not managing them well. You know, people don't leave companies, they leave managers, they leave bosses. And overwhelmingly in my practice, most of the people I see, it's because they have a poor manager. And there is a lot that you can do as a manager to help your staff. And these are some of the things that we're going to look at. So I want to talk to you about the burden of mental ill health. We don't have data, obviously, yet for what's going on now during the virus and during lockdown. But before this, studies that have taken place have showed that EU countries lose 136 billion euros annually from stress, mental ill health related, and this is to do with loss of productivity. In the US, this rises to between 200 and 300 billion annually, and this includes productivity losses, staff turnover, and compensation claims. We know that 15.4 million workdays are lost in the UK due to stress-related illness, and 37% of workers have quit businesses or quit their job because of the stress that they face. Stress is a huge issue in the world today. Stress is cumulative. We get stress from the moment we wake up. How many people is the first thing they do when they wake up is look at their phone, and they see those emails, they see those texts, and they haven't even got out of bed, and already they're getting that micro stress. Stress comes from noise. Stress comes from having a difficult boss. Stress comes from the relationships you have. Stress comes from, well, previously our commute, particularly in Nairobi. Stress comes from all sorts of areas, and it impacts us both physically and mentally. And we know that the cost for treating people with both mental or emotional and physical conditions are 2 to 3 times higher. The other thing we know is that stress exacerbates or makes worse every single illness that we have. And it is a risk factor in about 90 to 95% of all disease. So people who are highly stressed are more likely to get diabetes. They're more likely to get cancer. They're more likely to get, chronic disease conditions. And this is partly to do with what's going on in the physiology in your body when you're stressed, because of the increases in things like cortisol, the stress hormone, and the damage it does to your body. And also because of the way that people cope with stress, perhaps comfort eating, not exercising, not sleeping. And when you have a lack of sleep, that really causes issues with your physical health as well as your mental health. So what's the effect of stress and mental ill health in the workplace? So it's not just on the individual, but it's on how individuals react and what they end up doing that causes problems for us. So basically, the research shows that stress in a business contributes to 30% of the mistakes that your staff make. And employees who are under high levels of stress cost 40% more than your other employees. So it's because of the mistakes they make, it's because of the ill health they have, but it's also to do with unethical behavior. People who are stressed are more likely to do things like lie to customers. So an example might be in those days when we could go into a shop and you go up to a shopkeeper and you say, oh, do you have this pair of trousers but in blue? And they say, no, we don't. Even though they know that they're in the stock room and they haven't been unpacked yet, but they just can't be bothered to go and do it. Those are the kinds of things that stress workers do. They don't have any loyalty to the company. They're likely to just lie about what they're doing. They take shortcuts. Stress is also catching. Think back to when you were at school and you were doing exams and you're standing outside the exam hall and everybody's going, you know, have you revised this? Did you read this book? Have you, and you start to feel the stress. Stress is catching because in our brain, we have these things called mirror neurons, and mirror neurons are our way of picking up on the feelings and the emotions of the people around us. And experiments have shown that we can sense the emotions of people around us up to as much as 10 feet. So have you ever had that experience of walking into a room and maybe people are silent, yet you know something bad has happened, or there's some disagreement or some problem, because you can sense the emotion in the room? So stress is catching, particularly when your boss is stressed. A stressed boss, a stressed manager passes it on. Stressed leaders tend to be agitated, they tend to lash out, they make that negative behavior contagious, and it creates a toxic work culture. So there's that old thing, you know, the boss hits dad, dad comes home and hits mum, mum hits the children hit the dog, and the dog goes and bites the boss. That's the cycle that we see. So know that if you are a stressed boss, one of the best things you can do is try not to show that to your workforce, because it's just going to spread through, a bit like the virus that we're all dealing with. It's also stress going to lead to counterproductive behaviors or disengagement. And disengagement is one of the biggest problems that we face in business in Africa. What do I mean by disengagement? Disengagement are people who turn up and do the bare minimum. They're not particularly loyal to the company. They don't particularly go the extra mile. And there was a Gallup survey about 4 years ago, which showed that 1 in 3 workers in sub-Saharan Africa is actively disengaged. So these are unhappy people who are unproductive at work and liable to spread negativity to other people, most often because they're unhappy with the immediate manager above them. And for those of you in leadership positions, pay attention to where you see staff turnover. If you see lots of staff turnover in a particular department, it's more often to do with the manager of that department than because of the business or anything else going on. So that's why it's important to conduct exit interviews with your staff. So what about moving on to what we can do, and why should we be investing in mental health? Why should we be investing in health? Well, we know that that FTSE 100 companies who prioritize mental health outperform others by 10%. That's a huge margin to outperform by 10%. And when I say prioritize well-being or prioritize mental health, it's not necessarily that they are spending lots of money on this, but they're just changing their culture in the way that they address and talk to staff about emotional health issues. We know that there is a $4 return for every $1 that you invest in treatment of anxiety and depression, in terms of the productivity you can see from your workforce. And according to different studies, for every $1 spent on employee wellness, your medical costs fall, your absenteeism drops, and that's about a 6-to-1 return on investment. We also know that when you can encourage your employees to participate in health promotion isn't just about emotional health, but health promotion is getting people to get what I would call the basics right. Making sure people are sleeping well, that they're exercising, that they're eating well. All of these things are the foundations of good health. And if you're not sleeping well, if you're not eating well, then your body doesn't function. So leaders who care about their staff tend to be more successful, and the business tends to be more successful. So I'll give you an example. Virgin Airlines always focused on their staff. And their thinking was, if we focus on the staff, then the staff will focus on the clients. Too often, businesses and companies put their emphasis on their clients and not on their staff, which means then when their clients are in contact with their staff, they are in contact with unhappy people who are not doing the best for the business. And that's why, from a business point of view, it's worth thinking about how you invest in your employees' well-being. So what are some of the signs of stress that you can see? Some of the signs of stress you will recognize quite easily. You can normally pick up people who are feeling anxious or worried, or people who are very tearful. But also look for things like sleep problems. Look for people who are gaining a lot of weight or losing a lot of weight. Look for people who are overly apologetic. Look at people who have got issues around they're very quiet, or they're withdrawn. These are all people who may be having emotional health problems. People who lose their temper, who get angry, who send it out, who shout, they're obviously also have problems. There is a sort of, in some businesses, there is a culture of shouting and yelling at people. This is not acceptable, but we see it a lot. And it's often to do with the fact that the leaders or the managers themselves have got some emotional health problems, and that's why they're sending them out. I teach on a leadership course, and this week, the session that I'm going to be teaching about is around anger management, and particularly anger management amongst those at the top of the organization. And we know that it contributes to a lot of stress amongst your junior employees. So dealing with mental health during lockdown, what can you do and what can you advise your staff? One of the most important things to do is to minimize your exposure to the news. Pick 1 or 2 times a day when you're going to check in with what's going on. Now, I think for a lot of people, we've become almost immune to the news because we've heard so much, and but at the beginning, often at the beginning of any crisis, people get addicted to watching the news and seeing what's going on. And this just contributes to your stress. And it tends to be that the story is running the whole time. And like I said, and remember, stress is catching. So minimize news feeds. You do need to maintain social contact, and it is difficult, particularly for those in isolation. And the 2 groups who are really suffering in this whole lockdown are young people who live alone, and then parents with young children. They're the 2 groups who are really struggling with the lockdown, but for different reasons. And those living on their own, it's because of the lack of social contact. Sounds silly, but you need to maintain some discipline and some basic hygiene, yeah? Getting up, showering, making your bed, doing all those things. One of the most important things that we do when we're working with people with depression is we get them to make their bed in the morning. It sounds like a really silly thing, but just doing that one thing means you've already achieved something. And back to what I said to you about locus of control and learned helplessness, when you start to take control of the things you can take control of, it gives you a foundation to build upon. So doing those small things that you have to do, doing your housework, cleaning up. One of the things, for example, that my husband still does, even though he's working from home, is he puts his office clothes on. He puts his, shirt and tie, even to go and work from one of the bedrooms, because it makes him feel like he's at work. So those disciplines are actually very useful to us. I saw on CNN recently a poor reporter who changed the angle of his computer, and it showed that he was, although he had a shirt and tie on top, he was in his underpants, and it went out on CNN News. So be careful on what you're wearing. Limit your alcohol and drug use during this time. Obviously, we're never going to advocate for people to take drugs, but alcohol is not the answer in lockdown. And it's also, when you're in isolation, likely to start to tip into something which is going to be more draining on you and become a problem. Screen time is a big problem. We are on screens all day on our computers, we're in these endless conference calls, but also people are then on their phones. We know that being on screens is very disruptive to your sleep, so make sure you have some downtime. Screens also include TVs, by the way, so try and minimize the amount of time. Try and have a break away from a screen. If you can get outside for a walk, if you can do something that takes you away from it, will be very good. Also, social media can be quite good in helping you feel like you have some social contact, but we still, even in coronavirus, tend to put two things on social media. One, which is we create a world which is unreal. So at the beginning of lockdown, there were endless pictures of the banana bread that everybody was baking in the first few weeks of lockdown. And then the other thing that it moves to is people complaining. So again, you know, moderate the amount of social media and monitor how you feel. How is it making you feel? If you've just spent a little while on Instagram or Facebook and you come away thinking, oh, I'm not good enough, then it's probably not a good thing for you to be spending time to do. One thing that we know really helps people's mental health is to help other people. What can you do? Whether it be buying some shopping for a neighbor, whether it's contributing to donating some goods or some money to helping those people in the informal settlements, what can you do to help others? It's going to help you feel better as an individual. And as a company or as an organization, what can you do? What can you get your employees engaged around in terms of helping others? It will really help to bring people together, and it will really help with that feeling of helplessness and those feelings of a lack of control. So what can employers do to help their staff? I think it's important to focus on being resilient and being adaptable at this time. So we know when we look back, for example, at the 2008 crisis, the companies that survived, the companies that succeeded, were all those which were able to pivot either into something new or who were more resilient, who were more adaptable, who were able to just try to look to the future and change what they were doing. The companies that folded were the ones that buried their heads in the sand and said, we don't know what we're doing and we're struggling. So you need these same traits from your employees as you as a company need to have. So you need to role model healthy behaviors, having a positive outlook, share how you feel. It's not about sweeping these negative feelings under the carpet. It's important to give a forum for people to air them, but then to say, okay, what are we going to do about this? How are we going to move on? Where can you take back that control? Where can you make a difference? What can you do? But recognize the risk of stress on staff and the increased risk, and make sure that as an employer, you are not contributing to it, that you are not asking for unnecessary things which are going to make it even harder for your employees. Remember, it's not one size fits all. You'll have some employees who are coping incredibly well and some who are not. Don't treat them in a blanket fashion. Make sure that you are being adaptable as well in terms of how you're treating different people and what you're asking them to do. So devise different strategies to manage different members of staff according to how they're coping. And remember that how one copes is going to change. So if you are suddenly faced with somebody who's caught the virus, that's going to change. Or if you know somebody who has died, or just if you've got to a particular point or you're having an issue with your partner, it's going to change how you're coping throughout this whole situation. Communication is going to be key. It's really important to be clear in your communication right now and to be unambiguous and have very timely information. There are so many rumors going around. There is so much misinformation, not just about the virus, but about the economy, about jobs, about what's going to happen. So you need to be very clear. you need to be very concise and get that information out as fast as possible. And you need to include both logical and empathetic statements. So what do I mean by that? It means that you need to let people know that you're listening and that you're caring. So small things. When you start a meeting, ask everybody, how's everybody doing today? What are you struggling with? As a leader, let people know, you know, I'm really struggling with, as Maxwell said, you know, being able to talk to my 5-year-old because she thinks that daddy's home and he should play. So make space for conversation and allow people to have emotional responses as well as logical responses. We also need to stay flexible about our preferred method of communication. So some people hate video calls. Some people would prefer a phone call. Some people would prefer email. Allow this to happen and trust that people are doing their work. I once worked for a boss who insisted that everybody, we used to use this very old-fashioned system called Lotus Notes. And when you were signed into Lotus Notes, there was a green light next to your name. And even when he was on holiday, thousands of miles away, in a different time zone, he would get up to check that everybody had a green light by their name. You know, this lack of trust in your employees is not going to get the best out of them. And in anything, what it's more likely to do is to make them disengaged. So what we want to do is we want to create an atmosphere, a culture where employees feel supported and they feel that we're on the same side, because this helps with this locus of control and helps with you not feeling so helpless. If you are a manager or a leader, shift your leadership style. We need more collaborative leadership. It's something you can read about, a collaborative leadership style. At the peak of the crisis, and Kenya hasn't reached its peak yet, at the peak of the crisis, you may need to be more authoritative. You may need to say, you need to do this. This is what I want from you. But most of the time what is called for is a more collaborative leadership style where you're working with individuals, trying to be open and adaptable to be able to help them make the most of the situation they're in and what they need to do. Relax the rules a little bit. Remember that people are going to be struggling, and understand that what people are going through. We have a tendency as human beings to assume that if I'm feeling okay, everybody else is feeling okay, and they may not be. So we need to make sure that if somebody says to you, I'm struggling with this, or I can't, that we don't say, why? It's not that difficult, just find a quiet place to work. We need to listen and hear people. Most people's emotional response or stress or anger comes from the fact that they feel they're not being heard and that their feelings are not being validated, that they're being dismissed. So be accessible, be empathetic. It's very hard to do any kind of team building at the moment. And we know that when you have a good work culture, that you have much, much higher productivity. But there are some things you can do in terms of virtual hangouts for social bonding. You can also have one-on-ones just on the phone and check-ins. Make sure that when you are, if it's an informal team meeting, that you spend a bit of time to ask people, oh, has anybody watched anything good on TV, or what are you up to? Have that human element. Remember, we are human beings. And as the manager, as the boss, as a leader, remind people to switch off. We need to limit the amount of meetings. These video meetings, these virtual meetings actually require more concentration than being in a face-to-face meeting. And we need to limit who participates. So if people are not talking in those meetings, they probably shouldn't be in them unless it's much more of a kind of presentation. So check out whether you have the right people who are attending, so that you don't start getting this boredom and disengagement, which is very counterproductive to your business. Think about the resources which are available and see what you can locate. Currently at the moment, it's very difficult in Kenya and in other countries. There are few counsellors or therapists who are seeing people face to face, but they are seeing people online. Check in with your HR team where you have one and make sure that they have set up a system, whether there are key people that people can go and talk to, and think about also what kind of financial support you can give to people. You know, the leaders who are going to come out of this doing badly are the ones who fail to recognize that there's going to be a lot of psychological impact for people. And I guess by the fact that you're on this webinar, you're not one of those people. But there's a lot of uncertainty, there's a lot of fear, there's a lot of new emotions that people are feeling. Don't force people to do things that they're not comfortable with. Don't assume that everybody is dealing with this the way that you are. There's a few apps that you can use that can help people. I've put a few of them here: Mood Mission, Calm, Insight Timer, Smiling Mind. Reach Out Worry Time is a good one for connecting with people that you're worried about their health. But there are many more. There are things that we can do that can help. Many of these are free. I would encourage people to try and get outside, to try and do exercise, try and do those basics. And as an employer, also encourage people to do those things. As I said, these are unprecedented times. We're all learning, we're all feeling our way, but there are many things that you can do. So thank you very much for your time today, and I will hand back to Maxwell.
Thank you very much, Dr. Yolande. I think that was really, really insightful and thought-provoking. I want to hand over to Gilles to just make some few remarks, and then I'll turn on to Q&A.
Well, thank you very much, Maxwell. So good morning, everybody. My name is Gilles Nijssens, and I'm the Business Development Director for Africa. Very honored to be part of this presentation and spend some time with all of you. Normally, I'm out and about all across Africa, and as an extrovert, I can guarantee that being locked up at home for now more than 68 days definitely has an impact on me. So thanks very much, Dr. Coombes, because a lot of the points that you raised really resonate for me personally. At CIGNA, we are proud to focus on the health and well-being of our own employees, but also proud of being the preferred health partner for our clients. So I would like to talk you through what you can do as an employer, what tools CIGNA offers to support our employees as an example, and how CIGNA is helping the communities we operate in to cope with some of the current burdens. So I would like to start with highlighting what you can do as an employer. And a lot of these overlap with what Dr. Coombes had just laid out, so I'm not going to dwell too much into detail. These are also initiatives that CIGNA is implementing for 120 staff based in Nairobi. So first of all, consistent communication. This is really key in a new world where most of the employees are working from home. It is easy to feel lonely and disconnected now. So it is truly recommended that you step up your communication, particularly in relation to your plans in response to the pandemic and your plans to go back to work. It is also important that you clearly indicate what tools are available for your employees during this crisis. Which brings us to the next point, which is to have support programs. We have noticed that particularly EAP, employee assistance programs, and remote access to care tools like telehealth are very popular at the moment. A third critical pillar is to focus on leadership. Again, Dr. Coombes already indicated how important it is if your managers are stressed and the impact on your entire workforce. So the role of leadership is crucial during these times. Therefore, giving all levels of your leadership the tools they need and train them to maintain the connection with their staff. Increased communication and clear leadership will help keep everybody engaged. Now, finally, maintaining a sense of future is critical. Indicating regularly on how your company views the future, the new future, or even better, involve your employees in building that new future. It is necessary to show them the proverbial light at the end of the tunnel where we can eventually move to a new normal. Next slide, please. So how do we as CIGNA support our own employees' emotional well-being, and how do we support our clients? So we have set up a number of programs, which you can see here. Employee assistance programs focusing on counseling, but also mindfulness and work-life balance. This is really critical. Next to that, we have online programs, and I would like to highlight the Make One Small Change program. It is really a program developed to make one small change at a time, but at the end of the day, by combining all of them, it will improve the behavioral and being able to deal more with stress. A third one, and I personally use it a lot with my family, telehealth. So we have, for example, activated it for all of our clients for 3 months during this period. This is particularly helpful because many people are stressed about their ability to access healthcare during the current situation. Myself, I'm based in Johannesburg, and I'm covered under one of the CIGNA plans, and we are very grateful as a family that we have telehealth. My wife is pregnant, and she has done most of the consultations through telehealth, minimizing the risk of her going to the hospital. But also, and this is important, telehealth can also be the port of first call for those who think that may be suffering from any anxiety or depression and need to speak to a GP to define the next steps. Same here, and Dr. Coombes mentioned that there might be a lack of supply on therapists. By telehealth and other programs, you can actually use supply from other countries. Now, final point is our content library that we put available for everybody. I'll also use a personal example of how I used it. So there are quite some papers, research in there based on loneliness or work from home. Based on that research, we have implemented a virtual coffee corner with the teams. So in order to stay connected, which is very important in these current times. So as a CIGNA employee, I've truly benefited a lot from these tools and was able to support and lead my team thanks to it. On the next slide, please. Thirdly, and that was my last point, we also believe it is very important to support the communities around us because COVID has a significant impact on a lot of countries and unfortunately on a lot of people. So what are we doing? We have a Healthier Kids of Our Future program, which is a worldwide program within CIGNA to help address 3 of the leading challenges identified through the United Nations Sustainable Development Goals: no poverty, zero hunger, and good health and well-being. Over the next 5 years, our goal is to engage all of our employees worldwide through community-based initiatives that address these 3 issues. The CIGNA Foundation is coordinating and sponsoring all of these events. However, they count on the different regions to come up with locally relevant initiatives. And this is where I'm very proud to announce that last month, the CIGNA Foundation confirmed the Hope Alive campaign, as you can see here, were a recipient of substantial donation towards the excellent work that they complete in Kenya. The CIGNA Kenya office will run with this initiative from our side. The campaign main program, A Cup of Uji, aims to provide a daily cup of porridge to less privileged school children. Currently, 3,000 children per day benefit from the program, but we want to extend it to at least 15,000 by the end of 2021. Malnutrition remains unacceptably high in Kenya, with 29% of children in rural areas and 20% in urban areas affected. During the COVID crisis, this has only increased. So we are truly looking forward to collaborating with the Cup of Uji program to work towards their goals and also assist, when feasible again, unfortunately, to invest our own time into the program. Our Nairobi staff will support with mentoring the children, engage in sport activities, and distribute food. So, despite the current COVID-19 pandemic and kids not being able to attend school, the Cup of Uji team went above and beyond and adapted by providing packages directly to kids at their homes. This not only shows the dedication of the team, but also their agility to still reach out and assist those kids in need. So I truly hope that this presentation was useful and would like to close with mentioning how important health is in general, but definitely mental health is in these challenging times. Mental health is unfortunately overlooked on many occasions in the African continent. We at CIGNA focus on supporting our employees and the communities surrounding us as much as we can, and hope that this presentation gives you some food for thought on how you can support your key stakeholders in these unprecedented times. I would like to thank you all for taking the time out of your busy days to join us, and we'll hand over to Maxwell for the Q&A session. Thank you very much.
Right, thank you very much, Jill. That was very, very useful. And I'm glad to see your Cup of Uji initiative gaining traction. I think that's really great. So we've run out of time, but since we are here, I want to just real quick field a couple of questions that we've received. And I think primarily it seems like most of them are addressed towards Dr. Yolande. So I want to combine two questions. The first question is on what can companies do to minimize stigma and develop an in-house culture that supports help-seeking behavior for mental health and mental well-being. I remember you talked about especially the challenge that men face when it comes to talking about their mental stress issues. I think this is really touching on that. And it's not just limited to men. I think really it's an issue of what sort of culture can we create that allows for mental health to be an open discussion within our companies and our businesses. And then the second question related to that is, so someone is asking that a lot is being said about being available and compassionate during such times. How do you deal with remote teams who do not readily open and share what they're going through? How do you avoid the sort of monologue that you can end up with on conference calls and still keep your wits intact without being too frustrated for the lack of demonstrated participation? So let's start off with those two.
Thank you. So for the first one, in terms of stigma, I mean, I think this is something we have to do across the country as a whole, is to change the way that we view mental health. But there are a few things that you can do. So one is, it's really important for the senior management team to model the right behaviors, for them to talk about, for example, taking a mental health day. I'm taking a day off work because I need a day to regroup and to just get my, sort my mental health out, in the way that you might say, I took a day off because I had a cold. Doing some corporate social responsibility, or just encouraging everybody to help with a mental health charity or foundation, just again gets the conversation going. Being able to check in with people and really ask them how they're feeling and how they're doing, and how are their stress levels, again makes this a more normal conversation for people to have. And these are the ways that we can start. There have been shifts in some countries as well, getting role models to talk about mental health. So for example, in the UK, there's been a lot of work around getting footballers to talk about mental health. But these are all things that when people see that people they look up to talk about this more normally, and in the case of your business, that's your managers and your leaders, it makes it more acceptable. But there are some other things you can do in terms of your HR policies, in terms of having a buddy system for people. So a buddy system is also quite useful with regard to that second question, and getting to be more compassionate, where you encourage people to get together in teams of 2 or 3, most often with peers, people the same level. Don't force it too much, but encourage them to check in with a buddy when they're not doing so well, when they're not feeling great about themselves, if you don't have access to external resources to help people. And the other thing is, for managers to check in. It's very difficult if you're on a Skype or Zoom call or a Teams call with 15 people, and a boss says, how are you doing? Of course, your response is going to be, I'm doing fine. So in order to really find out how somebody's doing, you need a one-on-one check-in, and probably better by phone, where a person can talk without having to look directly at somebody. Many people will find that more comfortable. But as bosses, regardless of coronavirus or not, we have to be more able to really ask our staff how they're doing, and not assume that everybody is okay.
Right, thank you, thank you. I'll take 2 more questions. The first one is, relating to what you talked about, the locus of control. the ability to, you know, for one to be able to drive their own outcomes vis-a-vis, you know, the other aspect being reliant on external forces. And the question here is, where does one find the confidence to keep working, knowing that there's a constant looming threat of job loss? You know, I think that's something that is really troubling a lot of people. And it may not just be job loss. And, you know, for business owners, it's actually the threat of losing your business, losing your livelihood. Just how do you, you know, find it within you, so to speak, all the confidence to keep plodding along and moving forward during these tough times?
Yeah. Yeah, and of course it's very difficult because we know these things are going to happen, but the feelings that we have come from our thoughts. So if you tell yourself, I'm going to lose my job, that means I'm going to lose my house and lose everything, and then perhaps, you know, my relationship will break up, that's going to make you feel much more overwhelmed, and overwhelm is one of the things that contributes to us feeling depressed. So we have to change the thoughts. Yes, I may lose my job, but I got that job, so it means that I have the ability to get another job. We have to take control over the things that we think about. If you allow yourself to enter into that spiral of downward thoughts. So for example, some people have a tendency to look for the worst, and some people have a tendency to look for the best, and we loosely call these people optimists and pessimists. But it's not something that you're born with. You can change it. And so when something happens, you need to try and see, how do you change that to be more positive? Yes, you know, so that's how we take control, and you do it with small steps. The small things that you can take control over. Well, I'm still in my job now, and I can still make the best of it. There are things that we can do to change this. What are the things that we have control over? How do we look forward? So back to that example I gave you about breast cancer. It's the people who roll over and give up, who become helpless, who are the ones that get the most stuck. So we have to remind people that we're not helpless. There are things you can do. There are small steps that you can take, and it's those small steps that over a lifetime lead to the life that you have. It's that when you look at it as one big thing, it becomes overwhelming and impossible. But break it down into small tasks, and all you need to do is the first one. I call it, you know, slicing the salami. You know, if you try and eat a whole big sausage of salami in one go, it's not going to fit in. But if you cut it down into small slices, you can do it. So work out how you're going to slice your salami, and then just work slice by slice.
Okay, great. And a quick and final question from me, and then maybe a much broader question. And I think you've touched on aspects of this as you spoke. You know, how do you avoid stress? I mean, it's just that simple. You go to the doc, you know, you have this ache somewhere in your body, and the first thing the doc tells you is, hey, you know, I think you're stressed, you need to avoid stress. And so, you know, don't take coffee, you know, don't eat XYZ. I mean, you're given a list of things that you need to avoid, and you're thinking, but wait a minute. I mean, these are the things that I truly enjoy. These are the things that make me feel like, you know, not stressed. So how do you just in a practical way, find a way of managing your life that, despite what is happening around us, relieves you of that stressful feeling or thoughts that we may end up going through?
Yeah. Well, a lot of stress, particularly at work, comes from two areas, which are kind of related. One is imposter syndrome, which is where you feel like, I shouldn't be in this position, I'm not coping, I'm not doing it well. And the other is from not feeling good enough. And not feeling good enough can sometimes come from you as an individual because of the way you were raised, if your parents were very harsh, but it can also come if you have a poor manager who makes you feel that you're not doing good enough at your job. So then you get these levels of stress, or when you feel that the demands coming on you are too many. So, the physical things that we can do in terms of, sleeping better, reducing coffee, all of those things, reducing alcohol. You see, alcohol, coffee, all of those things, they're just coping mechanisms, but they're not really dealing with the root cause. And the root cause is coming from the thoughts that you have, which are leading to your stress. So one of the best ways that you can change those thoughts and change the way that your thinking patterns is to really learn practices like mindfulness and meditation. And by that, I don't mean, sitting cross-legged and saying, but for example, going for a walk, not a brisk walk, not a run, but going for a walk outside in nature can make a huge difference to the way that you feel and the way that you think. And I would encourage everybody to spend half an hour outdoors with whatever nature they can find, because as human beings, we have an inbuilt system that de-stresses us when we are outside, when we are in nature. Very difficult in lockdown, I understand that. But most countries are permitting you to go outside for half an hour to get some exercise. If you can do one thing, that would be it. Rather than going to a gym, would be to even just sit outside whenever you can. When we look at nature, nature has got what's called fractals, and these fractals calm our minds much more than anything else that we can do. So learn mindfulness practices, learn meditation. Some of those apps I mentioned, like Insight Timer, it's free, and there are lots of ways to learn to meditate on it. Calm, Mood Mission, they all give you ways to learn mindfulness. If you practice mindfulness and meditation regularly, 10, 15 minutes every day, you will see a huge reduction in your stress. And one of my favorite sayings is that the Dalai Lama always says, people should meditate for 15 to 20 minutes every day. But if they're really, really stressed and time is difficult, then they should stress for 30 to 40 minutes. Sorry, they should meditate for 30 to 40 minutes. So the more stressed you are, the more that you need it.
Okay, excellent. I think that's a good way to sort of wrap this up. I want to invite us to take a quick poll that's coming up on your screen right now. It will only take you 5 seconds, just a quick poll, two questions. There we go. So as we close, I think the impact and the toll of this crisis on our mental well-being is clearly cannot be ignored. And as you've heard from Dr. Coombes and Jill and Leah, individuals and companies need to stay in touch with this reality, catering to our own individual mental health needs, and those of our teams can really give us a way of coping and managing through this process. I want to most sincerely thank everybody for joining us today. Thank you, CIGNA, for partnering with us on this webinar. A special thank you to Dr. Coombes for giving us really good and great insights and practical steps that we can take to manage our mental well-being. Thank you, Leah, and thank you, Gil, as well for your useful and thoughtful insights. For everybody, we've come to the end of our webinar this morning. Please look out for the recording of today's webinar. This will be made available in a subsequent communication to you, and will also be put up in our YouTube page. I want to just again say a very quick thank you for attending. I think this has been great, and I wish you all a great day, and please stay safe. Thank you.